Hello and welcome back to my channel. Today we're going to talk about a common but often misunderstood condition, hyperthyroidism. If you've ever experienced unexplained weight loss, a racing heart, or feelings of nervousness or anxiety, your thyroid gland might be working a little harder than it should. We'll break down what hyperthyroidism is, what symptoms to look out for, how it's diagnosed, and of course how it can be managed. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Let's start with the basics. What exactly is hyperthyroidism? Simply put, hyperthyroidism is a condition where your thyroid gland produces too much thyroid hormone. The thyroid is a small butterfly-shaped gland located at the front of your neck, and though it's small, it plays a huge role in regulating your metabolism. That means it affects almost every system in your body, from how fast your heart beats to how quickly your body burns energy. When your thyroid produces more hormone than your body needs, everything speeds up, sometimes uncomfortably so. The most common cause of hyperthyroidism is Graves' disease, an autoimmune disorder where your immune system mistakenly attacks your thyroid, causing it to produce excess hormone. Graves' disease often runs in families, and it's more common in women than in men. In fact, women are about 5 to 10 times more likely to develop hyperthyroidism than men. Another cause is toxic nodular goiter, also known as multinodular goiter or plumber's disease. In this condition, lumps or nodules in the thyroid gland start producing thyroid hormone independently, without regard to the body's actual needs. Over time, this can lead to hyperthyroidism. There's also a temporary form of hyperthyroidism called thyroiditis, which happens when the thyroid gland becomes inflamed. This inflammation can cause the gland to leak stored thyroid hormones into the bloodstream, creating a short-lived state of hyperthyroidism before the gland either returns to normal or in some cases becomes underactive. So, how do you know if you have hyperthyroidism? Let's talk about the symptoms. Since thyroid hormone affects nearly every organ system, the symptoms can be wide-ranging and sometimes subtle at first. Many people describe feeling anxious, jittery, or on edge, even when there's no obvious reason for it. This nervous energy can make it hard to sleep, leading to chronic fatigue. Another hallmark symptom is unexplained weight loss, despite having a normal or even increased appetite. This happens because your body's metabolism is in overdrive, burning through calories much faster than usual. Along with weight loss, you might notice muscle weakness, especially in your upper arms and thighs, making activities like climbing stairs or lifting objects more difficult. Heart palpitations are another common symptom. Your heart might feel like it's racing or pounding, even when you're at rest. Some people with hyperthyroidism also experience an irregular heartbeat, known as atrial fibrillation, which requires medical attention. Physical changes can include heat intolerance, meaning you feel uncomfortably warm even when others are comfortable or cold. You might sweat more than usual or find that your skin feels unusually warm and moist. Your eyes can also be affected, especially in Graves' disease. This is called Graves' ophthalmopathy, where the tissues around the eyes become inflamed, causing bulging eyes, eye pain, or double vision. In severe cases, it can even affect vision, requiring specialized treatment. Hyperthyroidism can also impact your digestive system, often leading to more frequent bowel movements or even diarrhea. On the other hand, some people notice changes in their menstrual cycle, with lighter or less frequent periods. As you can see, hyperthyroidism is more than just feeling a little hyper. It's a systemic condition that affects multiple areas of health. So, if you're experiencing these symptoms, how is hyperthyroidism diagnosed? The first step is a thorough medical history and physical exam. Your doctor will ask about your symptoms, how long they've been happening, and whether you have a family history of thyroid disease or autoimmune disorders. From there, the most definitive way to diagnose hyperthyroidism is through blood tests. The two key hormones measured are thyroid stimulating hormone, or TSH, and free thyroxine, or T4. In hyperthyroidism, TSH levels are typically very low. That's because the pituitary gland senses that there's already too much thyroid hormone in the bloodstream and tries to shut down production. At the same time, free T4 levels are usually elevated. In some cases, your doctor might also check levels of triiodothyronine, or T3, which can also be elevated in hyperthyroidism, sometimes even before T4 levels rise. If blood tests confirm hyperthyroidism, the next step is often a radioactive iodine uptake test or thyroid scan. These tests help determine the cause of the hyperthyroidism. In Graves' disease, the entire thyroid gland takes up too much iodine, while in toxic nodular goiter, only certain nodules will show increased iodine uptake. Once a diagnosis is confirmed, the next step is management, and the good news is that hyperthyroidism is highly treatable. The right approach depends on the underlying cause, the severity of symptoms, and individual factors like age, overall health, and personal preferences. The first option is antithyroid medications such as methimazole or propylthiouracil. These medications work by blocking the thyroid's ability to produce new thyroid hormone, helping to bring levels back to normal. Antithyroid drugs are often the first line of treatment, especially for Graves' disease, and many people respond well to them over the course of 12 to 18 months. For people who need a more definitive treatment, radioactive iodine therapy is another common option. This involves taking a small measured dose of radioactive iodine, which is absorbed by the thyroid gland and gradually destroys the overactive thyroid cells. Over time, this leads to a normalization of thyroid hormone levels, though many people who receive radioactive iodine eventually develop hypothyroidism and need lifelong thyroid hormone replacement therapy. I just wanted to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any topics you want covered in future videos. Anyway, surgery is the third option, though it's less common. A thyroidectomy or removal of all or part of the thyroid gland may be recommended for people with large goiters, suspicious nodules, or severe Graves' ophthalmopathy. As with radioactive iodine therapy, thyroid hormone replacement is usually required after surgery. In addition to treating the underlying thyroid problem, managing the symptoms of hyperthyroidism is an important part of care. Beta blockers, such as propranolol, can help control symptoms like a racing heart, tremors, and anxiety while other treatments take effect. For people with Graves' disease, treating the eye symptoms often involves additional therapies, such as corticosteroids to reduce inflammation, special glasses for double vision, or in severe cases, orbital decompression surgery. A critical piece of managing hyperthyroidism is regular follow-up care. Thyroid hormone levels can fluctuate over time, especially during treatment, so periodic blood tests are essential to ensure that your levels remain in a healthy range. It's also important to take care of your overall health during and after treatment. Eating a balanced diet, getting regular exercise, and finding ways to manage stress, such as yoga, meditation, or therapy, can all make a difference in how you feel. One final takeaway is that hyperthyroidism isn't something to ignore. Left untreated, it can lead to serious complications including heart problems like atrial fibrillation, osteoporosis, and a rare but life-threatening condition called thyroid storm, where thyroid hormone levels become dangerously high. But with the right treatment and care, people with hyperthyroidism can lead healthy, active lives. Thank you for watching. As always, take care of yourself and make the most of your day.